Do you have impaired mouth syndrome? Let's find out. Okay, welcome back to the Dr. Vincent Buscemi Podcast. I'm your host, Dr. Vincent Buscemi. I've had a lot of patients come in and say, hey, I see you on the YouTube. I see you on the TikTok. So I'm so excited that my patients are starting to listen to my podcast. And any patient listening now, thank you so much. I love treating you, and I love doing the podcast. Let's start with a story today. Last week, 2 weeks ago, I had a 5-year-old patient come in and a mother. If I had to guess, mother was late 20s. Patient's 5 years old. Patient is speech delayed, even nonverbal. Mother says patient's not diagnosed with autism, not diagnosed with any cognitive impairment. He has full comprehension, but he has a diagnosis of low muscle tone. He has trouble controlling his tongue. He is in special ed classes only because he can't speak. And the mother started to cry and said, I know he can speak. And I said, well, how can I help you? She said, well, I noticed that you advertise airway dentistry on your website, which I do. That's not an official term. Basically, airway dentistry is dentists are using orthodontics to expand your maxilla, which is your top jawbone, which would lead to an expansion of your upper airway, which are the two behind your nose and your mouth that will lead to better breathing. I said, I'm just getting into it. I'm training with Dr. Felix Liao. I have my first course early May, and it's about a year. And I fly down a couple times, and I train with him and a lot of online training. And the certification is called the Airway Mouth Doctor Certification. She goes, that's why I'm here. And I said, okay, well, tell me. She said she saw someone on TikTok where the mother brought a son in to a dentist who has similar training that I'm getting, or something in orthopedics, which is moving of the bones. And the child went from nonverbal to verbal after wearing a face mask, getting expansion. And that just blew my mind. And I asked this mom if she could reach out to the other mom on TikTok and ask her, who's the dentist? Because if we find out who the dentist is, I'm going to reach out to that dentist and see if I can find out where they got the training. And here's where it gets a little iffy for me. And the mom feels this way too. The mom I spoke to is that, and I left this part out of the TikTok video I posted about it. This other mom on TikTok charges other moms to be part of a group. And if you're part of this group, you then have access to her and access to her providers, I think. I didn't get such a clear description of what goes on. But if you have a orthodontic or dental or airway solution to help kids go from nonverbal to verbal, if you have that, and you're charging other moms not to fix it, but just access to the people who can fix it, I think your business model sucks. I think you're a crappy person, because it doesn't cost you anything to tell people where they can go get help. It's not like you are the doctor. It's not like you have such high overhead in your life. You could potentially direct a child in the right way to the right person to change their life forever. But then you're charging people for the information. So I don't know if it's a scam. The more I read about impaired mouth syndrome, which we're going to go over today, I don't think it is. I've never treated anyone with impaired mouth syndrome. The medical and dental community don't recognize impaired mouth syndrome as a syndrome, a collection of symptoms. But there's a dentist named Felix Liao. He's been a dentist for 40 years. He's been treating patients in jaw orthopedics for 40 years. And he came up with the term impaired mouth syndrome. And I want to take the next 30 minutes to 7 hours to go over, I'm joking, it won't be 7 hours, to go over what impaired mouth syndrome is. Here's my declaration to all my podcast listeners, all my patients, anyone who comes across this TikTok, anything. If that mother connects me with the dentist, if the dentist exists, that turns a child from nonverbal to verbal through jaw orthopedics, I will commit the rest of my career to this part of dentistry. I will get so busy, I will give up drilling and filling, I will give it to an associate, and I will just do this. Because if I can impact a child that way, selfishly, that will fulfill my career. Okay, so podcast title, The Hidden Epidemic, Understanding Impaired Mouth Syndrome. It's not fringe anymore to believe our mouths are shrinking, our jaws are shrinking. We have higher rates of sleep apnea, higher rates of dental decay, higher rates of children breathing through their mouth, higher rates of ADHD, higher rates of kids on the spectrum, autism, and maybe all this related to impaired mouth syndrome. So what is impaired mouth syndrome? Basically, it is, well, Dr. Felix Liao calls it 6-foot tiger, 3-foot cage, which I'm finding that's a cool title if you're a dentist, but it's not the coolest title to tell patients about. Basically, your upper jaw, your maxilla, is a bone in your face, and it basically drives this entire treatment. The more constricted or narrow or vaulted your palate is, your maxilla, the roof of your mouth is your maxilla. That's the floor of your maxilla. The more constricted that is, the more your lower jaw, your mandible, gets pushed back. Because your mandible fits into your upper jaw, your maxilla. And the more your mandible gets pushed back, the more your tongue gets pushed back. And it constricts your airway and can increase the chance of sleep apnea. For some reason, orthodontists don't believe this. I don't know why. I went to school, dental school with orthodontists. They're smart. They're in the top 10% of the class. But they just won't think outside the box enough to believe this. Fortunately, I should say not all of them. Some of them do, some of them don't. The one I work with, she's pretty open-minded, pretty holistic thinking, and she believes this, or believes some of this. In orthodontics, it's generally believed you can't expand the jaw past 13 or 15 years old, but Felix Liao has been doing it. John Mew has been doing it. All these people, I don't even know if John Mew's alive anymore. Look up Mike Mew or John Mew online. They've been expanding for years. So it happens. It just, I don't know why it's not accepted. So, what are some key signs of impaired mouth syndrome? Crowded or crooked teeth. Basically, if your jaw is underdeveloped, your teeth don't have room to be straight. Ideally, when we were hunter-gatherers, all 32 teeth, so all your regular teeth and your wisdom teeth came in the mouth, were straight, and didn't need braces. Look at the book, I think it's by Weston A. Price, Nutrition and Physical Degeneration or Degradation, where they show these tribes that were kind of undisturbed in the 30s and 40s, and these children had wide open, happy, beautiful smiles that were not crooked, they didn't need braces, and no decay, because they did not have the processed foods and the problems we have for shrinking jaws. What else? Mouth breathing. When I was a kid, it was an insult to call another kid a mouth breather. I see it all the time in my patients, that they're breathing through their mouth instead of their nose. And the more you breathe through your nose, the more nitric oxide you can get into your body, and it links to much more health benefits. And you just know this yourself. If you plug your nose for a day, you should read the book Breath by James Nestor. He artificially plugged his nose for 10 days. His blood pressure went up. He felt terrible. His anxiety went up. He had more depression. Breathing through your nose is how humans were designed to breathe. Your mouth is like an emergency valve. What else? Frequent headaches, TMJ, the joint, TMJ pain, neck tension. All of this is aligned to underdeveloped jaws, poor airway function, poor circulation, snoring. I snore. I may be 10 pounds overweight, but I'm doing my best like you are. I snore. I wake up fatigued. I wake up just looking like a train hit me. So I'm actually going to be my first patient for this treatment. And I'm going to document it online. And if I mess up, I'll sue myself and get rich. But I'm going to start treating myself. I'm going to treat two of my hygienists. I only have two. Both hygienists. They both want to do it. Poor posture. Forward head posture. One of my patients said I look like Jeremy Strong from Succession. I don't take that as a compliment. My chin's protruded. My head's going forward. I need this. And once I start to treat other patients, I think they'll benefit too. So Dr. Liao argues that these issues don't just happen randomly. They develop because our modern lifestyle has changed the way our faces grow. Our ancestors had, and this is true, look it up in the book Jaws by Sandra Khan, wider jaws, perfectly straight teeth, and no need for orthodontics. But modern diets, bottle feeding, soft foods have led to underdeveloped mouths. Here's what's kind of crazy. I did a podcast on the oral microbiome and how you can affect the oral microbiome over the kids' developing years. And a lot of the things that you need to develop a healthy oral microbiome are what you need to develop a wide open jaw, a fully developed jaw. Nature hasn't figured it out. If you believe in God, or if you're an atheist and you believe in evolution, humans have been around for a while. And we used to have big jaws. So we are designed a certain way, either by accident by nature or on purpose by God. And we are going against our design because our jaws are shrinking. I see so many patients that have retruded jaws, crooked teeth, and even if we take the total health out of this, it really affects their mouth. Sometimes their very back teeth, called molars, second molars, are so small that if they break the tooth, you can barely fit a crown on it and it has to be extracted. Their bites collapsed. So this is almost needed in everyone. And you see this. You see really healthy, good-looking people, and then they turn to the side and their chin's in their throat because our chins are trapped by the upper maxilla. So where did Felix Liao get all this information? One of his mentors is David Singh, who's a researcher and dentist and PhD. He currently, I think he still works at Stanford. He wrote a textbook, which I have back here, where he talks about using oral appliances to not only straighten teeth, but to naturally stimulate jaw growth and airway expansion. And again, this is not well accepted in the orthodontic specialty, but people do it all the time. Here's another story. This is why professors never liked me. In 2013, I flew out to a dentist in San Francisco. I went to the University of Michigan, and he was doing this kind of treatment, but not using any of these appliances. I shouldn't say this, but he was making his own appliances in his garage. I think it's malpractice, and he was giving them to patients. I won't say the guy's name, and actually helping them. But I don't think dentists are allowed to make their own appliances. Anyway, I came back to the University of Michigan. I emailed the head of orthodontics, and I said, hey, I went to see this dentist who's actually treating people with multiple sclerosis, depression, anxiety, sleep apnea, Alzheimer's, Parkinson's, with orthodontics, and they're getting better. And here's where I made the mistake. When you're a dentist, your scope of practice is only the teeth in the mouth. If I put this appliance in your mouth and I tell you I'm treating your multiple sclerosis, they're going to send me to jail. So I accidentally told this head of orthodontics that this dentist is treating these medical diseases. And she emailed me back and said, I went to go visit a witch doctor. He's a scam artist. I need to have better critical thinking skills. And if I want to be successful in dentistry or orthodontics, I need to actually have a more scientific mind. So lesson learned, if someone spent their entire career and their entire income is based on knowing or living and practicing the status quo of a profession, and some young idiot comes to her and says, I saw this dentist treat multiple sclerosis, they're going to think you're a weirdo. So anyway, Dr. Liao and Dr. Singh use something called a DNA appliance, a day and night appliance. And basically, it naturally stimulates jaw growth. I won't go into all of the science as to how it does this, but it uses something called epigenetic programming, which seems wild. But epigenetic programming, genetics is your code in your body. Epi means above. So basically, it is a device that influences the environment that will influence your genetics to change the phenotype, which is the expression of your genetics. So you have a genotype, which is your genetics, and phenotype is how it's expressed. So the best way to explain this is there's a code in my body for genetics, the blueprint, how my hand's supposed to look. The phenotype is how it actually looks. So genotype is like the story, and the phenotype is how it sounds. So David Singh invented this device that Felix Liao used to use that would expand the maxilla in adults. So one of his most fascinating studies showed that using the DNA appliance can significantly improve sleep by widening the airway naturally. Unlike CPAP machines, which are just Band-Aid solutions, David Singh's approach reverses airway collapse by promoting natural bone growth. This is a game changer because it proves that even in adults with impaired mouth syndrome aren't stuck with this condition. There's a way to biologically and epigenetically correct it. Here's the hard part from my perspective. This is more of a business or a way of getting people to believe they have impaired mouth syndrome. That's why I'm here on this podcast. That's why I create TikToks on it. I see so many patients, and they've known me for something that's 5-10 years. And all of a sudden I say, hey, listen, your mouth's impaired. Do this $10,000 treatment and it'll fix you. That's hard. But I want to educate the public because how many kids do I see in my practice, at my kids' school, that just have collapsed, underdeveloped jaws, and they're struggling with ADHD. They're struggling with anxiety, depression, behavior issues. Look at a kid in your kid's school that's always misbehaving, can't sleep, bags under their eyes, and look at their mouth. There's a large chance they have impaired mouth syndrome. Quick coffee break. Oh, here's something new. I should have put this earlier in the podcast. I reached out to Dr. Ellie Phillips, and they sent me a promo code for her gum, and you get a certain % off. And I don't even know what % off it is yet because I haven't looked at the email. But when I edit this podcast, I'm going to put that in here. So, promo code Vince, and you get some money off Ellie Phillips Xylitol Gum and Mints. That's great. You're welcome. You owe me. Okay. Section 3, Chapter 3. How does impaired mouth syndrome affect the whole body? If you have time, you have to read Dr. Liao's book, 6-Foot Tiger, 3-Foot Cage. Honestly, it's not the best title for non-dentists, but it's a really good book. It really is. He has patients that have brain fog and ADHD-like symptoms. Why? Because the poor breathing due to the collapsed airway leads to low oxygen levels and affecting focus and clarity. You know this. You have a cold, your mouth breathing, you're not as sharp as someone who breathes through their nose. Chronic pain and TMJ disorder. If I can treat the mouth leading to improvement of TMJ and improvement of chronic pain, I would help so many people. I have so many people call me and say, I went to this one dentist. They charged me $10,000. They hooked me up to this weird muscle machine. It didn't help. So Hopefully this will lead me into treating TMJ disorders, heart disease, blood pressure. The correlation between sleep apnea and heart disease, it's not 1-to-1, but it's pretty close. Increased blood pressure is pretty close. This is interesting to me. Gut and digestive issues. Felix Liao states that if you have chronic gut and chronic digestive issues, it can be from impaired mouth syndrome. I have no idea if that's true. I would love to further investigate that. Okay, guys, what can we do? If you have impaired mouth syndrome, you have to go to a dentist that is a airway mouth doctor trained by Felix Liao, or a dentist that's trained in jaw orthopedics, which is not orthodontics. The whole idea is that this dentist has a oral appliance, and the oral appliance will cause the upper maxilla to widen, to grow, which will allow your lower jaw to come forward and stop trapping your tongue. And all of this leads to more oxygen through your nose, in your airway, into your lungs, and stimulates natural breathing, and actually basically restores our natural function. So in nature and science, there's something called form and function. And the better the form, the better this function. This operates all across the material world. Think about your car. If your wheels are circles, your car will drive better. If your wheels are ovals, I can't imagine how the car would drive. So the form of a functioning machine, or the form of a functioning human, which is kind of like a meat machine, the form will dictate how it functions. So the better your mouth is formed, the better your entire body will function. So seek a dentist who, you can't use the word specializes in airway dentistry because specialists will poop their pants, who focuses, who has training in airway dentistry. Maybe they use the DNA appliance, or Felix Liao calls his the Start Thriving appliance. But they use an appliance that induces epigenetic change to help your maxilla widen, your mandible move forward, and stop trapping your tongue. And someone who focuses on nose breathing over mouth breathing. And lastly, Felix calls it the bone building diet. And I beat this drum all the time. You got to just eat whole foods. I'm doing my best at it. I can't sit here and say that I am the best Paleolithic dieter, Weston A. Price dieter. I do eat processed food once in a while, but I really try to focus on whole foods. That will totally change everything. So, here's what I want to tell you. A lot of times, there's a missing piece to the puzzle. There's a missing solution to your diagnosis. Maybe you're super healthy, or you eat super healthy, but your sleep's not on point and you can't figure it out. You exercise, you have a good relationship with your family, you have low stress. It could be that you have a retruded chin, constricted maxilla, and you have impaired mouth syndrome. You don't have to see me, but I would go to Felix Liao, is FELIXLIAO, his website, Airway Mouth Doctor, and find a dentist who is certified in jaw orthopedics, in widening your maxilla, moving your jaw forward. I think this will change your life. So I hope this episode has shed some light on how your mouth can affect your overall body. I really appreciate you guys listening, and I'll see you guys soon.